when we think about borderline personality, we think about treatments like dialectical behavioral therapy, etc. With narcissistic personality disorder, there is often this statement or conversation that they can't be treated. It's very difficult to treat them. What are your thoughts, and how do you implement treatment in clinical practice?
Okay, so yeah, that is common. There is a study, it was a 2014 study, and they were following people with narcissistic personality disorder over a 2-year period. And they were just in general mental health treatment. So this wasn't specific tailored psychotherapy or treatment for narcissistic personality disorder. And over a 2-year period, those who stayed in the study, so there was a high dropout rate, but those who stayed, over half of them no longer met criteria for narcissistic personality disorder, right? So that doesn't necessarily speak to their level of functioning. You cannot meet criteria for a personality disorder, but still have quite significant disruptions in your kind of mental health or your relationships. So, I don't think we really know the answer to those questions, but the idea that narcissists do not change is just, it's just not true. We have data that they do change. How they change and what that change looks like, I think, is less certain. What I'd also say is when I started my career, I started my training in the early 2000s, and DBT and schema therapy were only just emerging at that point. And there was a pervasive belief amongst clinicians that borderlines can't be treated. They're very difficult patients, and that it's we should try and avoid taking them into our services if we possibly can, because we have nothing to offer them. And I think now, 20 years later, I don't think anyone takes that view. Now we realize that actually we have several good treatments for borderline personality disorder, including DBT and schema therapy and transference focused therapy and mentalization based treatment. It seems to be kind of take your pick. And my view would be take the therapy or mix of therapies that is most fitting with this particular person's needs and priorities at that particular time. And I think that's a good starting point for treating people with narcissistic presentations too. We know that it's a sibling with borderline, it's a cluster B disorder. So my view would be, well, let's start with, does this person need to learn some emotion regulation skills? Right. And it's kind of a surprise to me. So I'm more attracted to the kind of schema therapy side of things. But a lot of people will tell me CBT and CBT skills have been really useful to me because they give me the skills to step back and question my perceptions, or they give me some ways of interacting with people other than losing my temper with them. So learning some basic assertiveness skills can actually be really, really helpful. So that's kind of where I'd start. Do you want to do more skills-based work? Do you want to do more kind of work looking at childhood trauma and childhood neglect and unmet childhood needs? You might go down the more schema therapy or psychodynamic route. So that's kind of where I'd start. And what I'd also say is treat the axis 1 disorders first. Yeah. Because if someone's severely depressed or they've got an anxiety disorder, we have really good treatments for those things. So let's help people with those things and hopefully help improve their functioning and feel a bit better, and also build their relationship with us before we start delving into much more complicated personality-driven features.
Yeah, that's great advice. Treat the axis 1, then identify what are the aspects to be treated and have a discussion with the patient. That's excellent. With the treatment, could you sort of, can you share any insights or case examples even that illustrate sort of the process so that we can kind of step into your shoes for a little bit to see, how you address the start of the appointment maybe? How do you structure the conversation with the patient to structure the treatment process? Illustrate sort of the progress that might occur during the course of the treatment, addressing many of these narcissistic behaviors, helping the individual with relationships and themselves. Could you expand on that a bit?
Well, let's assume we're not treating the axis 1. We're really wanting to treat kind of narcissistic presentation. the first thing I would be doing is let's just kind of start forming some alliance with each other. So quite relaxed and kind of paying attention to the interaction in the room, because those kind of what the psychodynamic people call transference and countertransference, it will kick off pretty early and pretty strong. So you kind of be really mindful of that right from the off. But I would be looking at, well, tell me the history. Tell me, what are your current difficulties? Same as we would with anyone. What are the current difficulties? How are these impacting your work life, your relationships, your close relationships, also your friendships? What is going on for you? What is your internal experience like? And then assuming I'm kind of seeing the kind of grandiosity, the need to be special, the lack of empathy for other people, difficulties in kind of bearing other people in mind, the inability to tolerate failure in yourself and probably also in others, the idealization. You see a lot in the romantic relationships. It's like the fantasy of ideal love. This person has to be my soulmate. They've got to be the only one I can possibly connect with. What we have is really special, and then they're devalued. Well, actually, no, they're useless. They're not the right person for me. I'm going to split up with them and move on to the next person. So you get that kind of really disrupted interpersonal relationships. So what I want to then do is help the person make the links between, well, this is how I am now. These are the experiences I have. How does that link with my history, with my childhood experiences, with the way I see myself, my schemas, the way I see other people, the way I experience the world, the way I am in relationships, what am I bringing out in other people? So it's really starting to build up a good formulation with the person. And you can also work on, use the relationship you have in the room with them and give them feedback nicely about what it's like. Sometimes I'll say to people, I feel charmed to be with you. I look forward to our sessions because you're entertaining and you're very witty, and it's a joy to be with you in many ways. And then I also wonder, does that cover up something else? Are the things that maybe are more difficult to say, that are more painful to say, that maybe I could very easily overlook? So you can talk about it in that way if that's the kind of presentation you get. And with other people where they're more harsh or critical or demanding, you might have to say, I feel a little criticized.
Right.
And, it doesn't necessarily feel so comfortable for me. And then I worry if I feel criticized, I might get a little defensive, or I might start to try to be overly accommodating to you. And then actually what ends up happening is I start to feel a little pissed off because I'm being overly flexible with you. So I need to keep a check on that. And is that something that also goes on in your other relationships? So it's kind of inviting them to explore those kind of interpersonal processes. And then we see where it goes, and you just never know where it's going to go.
Yeah.
I think it's very hard to give an overall kind of these are the steps of treatment, because I think that
of course.
You fly by the seat of your pants, I think, in working with any of the cluster B disorders, because things can change so rapidly. And the other thing I really do like to do is to bring in, if there's someone available, is to bring in someone else who knows them well, to really find out their take on things.